Good afternoon, and welcome to this month's extended version of Take Two. This afternoon, I'm alongside here with Sergeant Rob Burns from the Tega Police Department and the Executive Director from Keystone Substance and Abuse Services in York County, Danielle Center. We're excited to have Danielle to help us along this month. Over the next couple of months, we're going to do a special series to address some issues that law enforcement sees as serious concerns within York County. We're going to talk about the opioid drug abuse, we're going to talk about underage alcohol crisis, and this month we're going to talk about medical marijuana. Right here in Tega, we've seen a huge uptick in suicides, drug arrests, and drug abuse. So we want to arm you with the knowledge we can so that you can try to help the people that you know. Danielle, thank you for joining us today. Let's get straight to the facts. Can you tell the audience, does South Carolina currently have a medical marijuana law?
There's actually 5 state marijuana laws. The first one is industrial hemp, legalizing the stalks and stems for industrial purposes. The second law is the legalization of cannabidiol, which you'll often hear known as CBD oil. The third law is the legalization of medical marijuana. The fourth law is decriminalization, and then obviously the fifth would be recreational marijuana. In 2014, South Carolina actually passed 2 of the 5. We now have legalized industrial hemp and CBD oil.
Interesting, Danielle. What can you tell us is the difference between the law that Nikki Haley passed in 2014 and what legislators are proposing for this year?
Right, so there's a big kind of misunderstanding between the legalization of CBD oil and medical marijuana. So CBD oil is the oil extract in the plant that you can actually pull off that does not get you high. And it's supposed to really just help with controlling those seizures that you often hear about. The ingredient in marijuana that does get you high is tetrahydrocannabinol, which is also THC. The law states that with our CBD, that there cannot be more than 0.9% THC. That's why you would not get high with that product. However, because there's no regulating agencies, people can sell CBD without it being tested, so you really don't know what's in it. Now, in terms of what's being proposed now for the medical marijuana bill is it's actually legalizing the THC part of it. So you can get products with up to like 90% THC. There's no kind of regulations really to cut off that level. This year's bill has eliminated smokable marijuana, which was different from last year's bill, but you can still have it for flowers. You can still buy flowers and buds, edibles, concentrates, and other products with THC. This year they did add a lot of conditions. There's many conditions, including like cancer, multiple sclerosis, epilepsy, PTSD, and the last thing that they mentioned in this bill that it could be used for is any other chronic or debilitating disease for which an opioid is currently or could be prescribed for by a physician.
2 questions, Danielle. If this bill is passed, would medical marijuana be dispensed through prescription at a pharmacy? And then the second question is, does marijuana as opposed to CBD oil have any true medical purpose that's been approved by the FDA or the American Medical Association?
Marijuana has not been approved by the FDA. And because it's not approved by the FDA, it cannot be dispensed through a pharmacy. So it would have to be dispensed through what we call a dispensary. There are already 4 FDA-approved medications with synthetic THC in it, so none of these are smoked, and you would have, dosage, how often it would be tested, but that is not happening with the marijuana sold in the dispensaries. In legalized states, we are learning that a lot of people are getting the medical marijuana for chronic pain. In fact, 90% of patients use it for chronic pain. And we found out that the population that's utilizing it the most is 18 to 35-year-old white males. So that's not your population typically in chronic pain. And the other concern with that we have is there is no diagnosis test for pain. It's pick a number 1 through 10.
Well, thanks for clarifying that, Danielle. Appreciate that. Now, as the director of the Keystone Substance Abuse, can you list some of the things you find concerning with all the knowledge that you have had in reference to marijuana?
Yeah, so I think it's very important to understand that marijuana is in the very, very beginning stage of research. There's a lot of preliminary evidence, a lot of clinical trials going on, and it's this article versus this article. They're all kind of contradicting at this point. However, there is a lot of evidence around THC, and every body of evidence that there's ever been has said THC is addictive. And so that's what's, really concerning, especially with organizations like ours. If you're smoking marijuana, it's the same thing like smoking a cigarette. It can lead to respiratory illnesses. It can lead to some other, just like illnesses just with your respiratory system and other chemicals that we don't know that are going into your body. The other thing that we're seeing in a lot of legalized states is the impact with marijuana and mental health. We're seeing that when THC levels get to an extremely high point in your body, that you can get to that level of psychosis. So they have a lot of people going to the ER for those kind of things. And we're in a mental health crisis, so that's really what's concerning for us. The other thing is, even though it's not legalized for children, alcohol is not legalized for kids. But we all know that kids are getting access to alcohol. Vapes are not legalized, and they're getting access to that. So we, with the kid's brain developing till the mid-20s, we do have concern that it's going to get into the wrong hands.
For us in law enforcement, it's all about the cause and effect. What's going on in Colorado currently after 5 years of the facts? Some studies have shown decreased test scores for students, increased dropout rates, increased DUIs to include fatalities, increased homelessness in Colorado, and the mental health increase, which Danielle touched on just a minute ago, is something that we're worried about. What is the cause and effect of something that we do, and has there been enough studies? Law enforcement doesn't have any issues with medicine that can help people through true medical problems. And we want them to get what they need. However, we gotta stop and say, if the FDA and the AMA haven't approved it, why is it okay? You have a government that's cracking down right now on vapes and jewels and prescribed opioids, but marijuana is gonna lean towards being okay. Common sense doesn't always seem to prevail in some of these questions.
Danielle, what you see on a day-to-day basis, for most part, what should parents and/or grandparents be concerned about in reference to the subject?
I think Chief Parker said it best. We want to help people that are sick, and we just want to make sure that we don't legalize something with putting the rest of the community at risk. And so that's where our kind of stance is, that we feel that medicine, if it's truly medicine, should go through the FDA process. And really, that's the way it's going to get into the hands of people that actually need it. Other concerning things about marijuana that, grandparents and parents might not understand is marijuana is very different from the 1970s. It's 4 times stronger than it used to be. They now have edibles that one cookie can get about 8 people high. There's a product, hash oil, that gets up to 90% THC. And so we really just worry about the impact that it could have on our children. Are we going to start seeing more and more kids becoming addicted to marijuana? Could that lead to other substances? Those are all things I think that we have to really start to think about.
In closing, we really want to thank Danielle Center for being here as a guest to give us information on the medical marijuana laws. It's important for us to let the community know some of the concerns that Keystone Substance Abuse has, as well as law enforcement. It's important for us to think about the cause and effect of some of these things have on our communities. Thank you very much, and we'll see you on next month's Take Two.
If you need help or know anyone that needs help, please contact Keystone Substance Abuse Services at 803-324-1800.